Shriners Hospital is a very special place, and I have the privilege of taking care of children with the most complex issues, regardless of their means, and it really is a really special thing for me.
The culture of the hospital is one that is more like family.
One of the best, if not the best place to come for orthopedic care in the nation, if not the world.
We have a staff of outstanding orthopedic surgeons who help us in providing state-of-the-art care for patients with problems in lower extremities, problems of their spine, problems of upper extremity, secondary to either something that a person is born with, a congenital abnormality, or in many times developmental abnormalities.
The expertise of our surgeons and staff here also goes along with the amount of extraordinary patients that we have.
We know in medicine that the more experienced a surgeon and a team are in taking care of a child's problems, the better they will be at it. So we have a huge experience in very rare conditions.
Some of the most complex patients, complex lower extremity and upper extremity problems, those patients come here. And because we have a complexity of patients who we treat, that we then develop our expertise in addressing the most complex needs of these children.
The doctors, physical therapists, us in the POPS department, we're all in the same spot so that we can collaborate together, and many times we'll do treatments together or we can do consultations all together as a team.
That means for the patient that they're going to get the best care that they can possibly get.
If the diagnosis is anything less than straightforward, we have a team. And so this team of physicians and therapists and nurses work together to figure it out if it needs to be figured out, or plan the intervention if it needs to be planned.
We also are very family-centered. There's a very nurturing atmosphere in the facility, which is part of the Shriners philosophy across the country.
It's great to hear about their research. I mean, they're definitely the leaders in their field, and I think that also sort of sets the bar for the rest of us that are here to contribute in the same way.
I am very excited to be here to establish what's going to be the largest and most innovative research laboratory in pediatric musculoskeletal research in the world. So what we're doing is developing these new therapies in the laboratory and hopefully testing them in what we call preclinical models.
Our role is to take care of kids with pretty much any type of problem with the upper extremity. That includes kids born with problems, kids with trauma, kids with nerve injuries, missing parts of the extremity, too many parts of the extremity.
I have 3 children that are patients at Shriners Hospital, and they were born with a rare hand disorder that caused them to need surgery on their hands.
I had 6 fingers on this hand, but I don't remember how. I remember. He had 7 on this hand and 6 on this hand. No, I don't.
Our youngest daughter, she was actually born without thumbs, and so Dr. Goldfarb was able to take one of her digits and turn it into a thumb on each hand, and now her hands function like everyone else's.
5 and 5. 5 and 5 make 10. And me and Chase can snap.
To know that the person who developed the procedure itself in fixing this condition in children around the world is the one going to be doing the procedure on my daughter, that peace of mind I cannot even express in words.
I've been at Shriners since I was 2 years old, and the reason I am at Shriners is because I was born with very severe scoliosis.
Cases that we see at the hospital go everything from the very common and ordinary adolescent idiopathic scoliosis, which is of mild degree, to the very severe syndromic scoliosis. We see the gamut all the way from the very simple to the extremely complex.
Everybody says, "How are you so brave and you can do this?" It's not really me being brave. It's the fact that I'm comfortable with where I am, and I trust the doctors who are taking care of me.
If it weren't for Shriners Hospital, she would not have a normal life, you know? No. And that's a real gift and a real blessing for our family.
AJ actually came into our lives as a foster son when he was 5 weeks old, was when they released him from the hospital. His right leg did not form correctly in utero. At that time, the doctors had said that they didn't feel that he would have a fulfilling life with the leg that he had. It was much shorter and smaller than his other leg. So it was decided for disarticulation, which is they removed the lower portion of his leg, like right through where his knee joint would be.
Basically, in the POPS department, we evaluate and treat children that need prosthetic limbs and braces. Children love to run, they love to jump, they love to play. So being able to give them the ability to do that better is incredible.
It makes me feel happy when I come in because I got a leg to walk on.
What this hospital has done for him and our family, it can't repay it.
The Shriners made a commitment in the early 1900s to take care of kids with bone diseases and then with burns, and have continued in that mission, raising money and finding the best doctors in the country and the world to accomplish that mission.
I was born with a birth defect on my right leg. When I was born, my right leg was shorter than my left leg. The foot was deformed. I only had 3 toes instead of 5, and the ankle wasn't fully developed. So for the next 16 and a half years, until I was 18 years old, Shriners Hospital took care of me. And that gave me the ability to have a normal life.
But people are here because they believe in the mission of the Shriners Hospitals.
Working for an organization like this, where I'm able as a practitioner to provide what I see the patient needs, regardless of what the insurance companies will pay for, and not taking that into account is huge.
What's the center of the whole charity aspect is doing what's best for the patient, regardless of their ability to pay.
We give children and their families opportunities to live full lives.